Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and today our topic is going to be on arthritis in our dog and cat patients. Arthritis actually is very, very common. We see it in young dogs, we see it in older dogs, and it happens in about 1 out of every 3 canine patients. A little bit less in cats, but we certainly see our share of this in kitty cats. There are many reasons for arthritis. Everyone thinks about hip dysplasia. That is certainly one reason. That's a congenital or a inborn disease that creates arthritis down the road. There are other reasons though. One is infectious causes, such as tick-transmitted diseases like Lyme disease or Rocky Mountain spotted fever. The other one that we see is traumatic injuries, being hit by a car perhaps, but more importantly, rupturing or tearing a ligament, the ACL ligament in the knee. I'm going to show you some x-rays here that kind of gives you an idea. These are some of the things we need to do to diagnose arthritic problems. These are x-rays that have nice, perfectly formed hips in a 5-year-old dog that has no evidence of hip dysplasia nor arthritis. This is a great example of how we have a dog that has a normal hip on one side, the right side, and how the dog has an arthritic hip on the opposite side. We're going to show you a couple of other examples. This is an example of a dog that has an infectious disease. And this is a dog that has Ehrlichia, which is a tick-transmitted disease, in its ankle joint. Side view of the ankle, the normal, clean knee joint, very dramatically arthritic ankle joint. This is another one that we have that's a cat that was hit by a car when it was young, and all of this down here is arthritic change. This area, very, very normal. All of this is very arthritic. So when we start to think about arthritis, we just don't want to say, gosh, he probably has hip dysplasia. There's a lot of things that we need to do to figure out what the problem really is. Looking at the lower back, looking at the hips, looking at ankles, sometimes testing for tick-transmitted diseases. And those are the ways that we start to go down the path of helping our patients with arthritic problems. I'm Dr. David Roberts from Manchester West Veterinary Hospital, and in part 2 of this, we're going to talk to you about treatments of arthritic changes. Thank you very much.